The dog got there before anyone else did. That was the first thing Nadia noticed when the gurney came through the trauma bay doors. Not the blood soaking through the field dressing on the man's thigh, not the two soldiers running alongside, shouting vitals, not the sound of equipment clattering off the wall where the doors hit too hard. The dog. A Belgian Malinois with a military harness, still buckled tight, ears flat, body pressed against the side of the gurney like it had been welded there. Nobody had told the dog to stay. Nobody could have told the dog to leave. She was already pulling on gloves when Dr. Harlan stepped in front of her. "Trauma 1, he said. "Gunshot, right femoral, BP's dropping, I see it." She moved around him. The dog's head snapped toward her. It didn't bark, didn't growl, just fixed her with a stare that said, "I see you too." Nadia had been a trauma nurse for 6 years, most of it at a naval medical center in Portsmouth, and she had seen working dogs brought in before, injured animals, dogs in distress, the occasional therapy dog walking the oncology ward. She had never seen one like this. The Malinois had a posture that reminded her of the soldiers she worked with, contained, watchful, not afraid, exactly, aware. One of the soldiers, a woman with a staff sergeant's patch and mud still drying on her boots, caught Nadia's eye. "His name is Cypher," the woman said. "The dog. Don't reach for the patient without letting Cypher smell your hand first. He won't let you." "I need to reach the patient," Nadia said. "I know. That's what I said." Nadia stopped, looked at the dog, extended her left hand, palm up, fingers loose. Not toward the dog's face, just low, at the edge of the gurney, near the man's hip, offering. Cypher looked at her hand, then looked at her face, then looked at her hand again. The man on the gurney, Staff Sergeant Devlin Marsh, the intake sheet said, 31 years old, special operations, turned his head and said something so quiet she had to lean in. "He'll figure it out," Marsh said. His voice was even despite the blood pressure reading that had just dropped another 6 points. "Give him a second." She gave him a second. Cypher pressed his nose to her palm, held it there. Then stepped back exactly 1/2 step and sat down with his back against the gurney wheel, which she understood, somehow, was his version of permission. "Thank you," she told the dog, which was not something she had ever said to a dog in a trauma bay before. She went to work. Devlin Marsh was in surgery for 4 hours. When he came out, he went to the ICU on the 3rd floor, and Cypher went with him. The orthopedic team had objections. The infection control nurse had objections. The attending physician, a man named Dr. Pruitt, who had been working this ward for 11 years and had the posture of someone who had stopped being surprised by anything, looked at the dog, looked at the 2 special operations handlers who had materialized in the hallway, looked back at the dog and said, "Fine, but he doesn't go past the threshold." Cypher went past the threshold. Nobody argued about it after that. Nadia's shift ended at 7. She stayed until 8:30. She told herself it was the chart. Marsh's post-op vitals needed to be entered, and there was a discrepancy in the medication log she wanted to sort out before she handed off. That was true. It was also true that she kept finding reasons to pass the ICU on her way to anywhere, and each time she passed, she glanced through the window, and each time she glanced, Cypher was in exactly the same position, pressed against the left side of Marsh's bed, chin on the mattress, eyes open. She drove home, made eggs she didn't eat, sat at her kitchen table for a while. In the morning, she came back. Marsh was awake by day 2. Not alert, the pain medication kept him somewhere between present and not, but his eyes tracked movement when she came in to check his drain and adjust the compression cuff. Cypher watched her with the same focused attention as before. Not hostile, just thorough. She had the persistent feeling of being evaluated, though she couldn't have said what the criteria were. On the 3rd morning, Marsh said, "You're the one who was in trauma." "I was," she said. "You talked to him." "I thanked him," she said, "for letting me work." Marsh made a sound that might have been a laugh if he'd had more room for it. "He remembers things like that. Does he? He remembers everything." Marsh closed his eyes. "He's been with me for 3 years. Knows my blood pressure by my breathing, I think. He doesn't like it when I'm scared. Are you scared now?" A long pause. "Not right now," he said. She wrote it in her notes as patient demonstrating appropriate affect, which was the clinical way of saying he meant it. The thing nobody explained to her, the thing she had to piece together from overheard conversations and careful non-questions, was that Marsh hadn't been brought here from overseas. He'd been brought from a facility 40 minutes south, which was not a place most people knew existed, and which was referred to in the 3 separate conversations she half-heard only as the sight. He had been shot during what someone called a transfer. When she asked the staff sergeant with the mud-dried boots, whose name turned out to be Calloway, first name never offered, what kind of transfer, Calloway looked at her in a way that was not unfriendly, but was very clear. The kind where things went wrong, Calloway said. Nadia had been in the Navy for 4 years before she came to work at the medical center as a civilian contractor. She knew what that meant. She didn't ask again. What she did do on the 4th day was notice the man standing near the elevator. He wasn't a patient. He wasn't staff. She knew every person on this floor by sight, and she had a particular memory for faces, always had, the kind of recall that made her good at continuity of care. He wasn't a visitor. Visiting hours on this wing were restricted and required a badge scan she would have seen logged. He was wearing scrubs, blue, which anyone could buy at the gift shop downstairs. He was looking at his phone, which everyone did. But he had been standing near the elevator for 22 minutes, she realized, and had not gotten on it once, and each time she moved through the hallway, he tracked the movement with a peripheral attention that he was just barely controlling. She went to the nursing station and pulled up the badge log. His ID had scanned in at 0614. It belonged to a respiratory therapist named Weston, first name Gerald, who was currently on scheduled leave for a family event in Ohio and whose photo in the employee system looked nothing like the man by the elevator. She picked up the phone. She called security first. Then she called the number Calloway had given her on day 2, which she had entered in her personal phone as C and had not expected to use. Calloway answered on the second ring. "There's a man on the floor," Nadia said. "Stolen badge. He's been here for 23 minutes watching the hallway outside Marsh's room." Silence. "Then where are you right now?" "Nursing station. East side. Stay there. Do not approach him." "Is the door to 314 closed?" "Yes." "Is Cypher inside?" She looked down the hall. She could see the gap under the door. "Yes." "The light's off in the room. Marsh was sleeping 20 minutes ago." "Okay," Calloway said. "Nadia, listen to me. If anything changes before we get there, if that man moves toward the room, if the door opens, you hit the emergency call button on the wall panel, not the phone. Understand?" "Understood." She hung up. Watched the man by the elevator. He wasn't looking at his phone anymore. He was looking at her. What happened in the next 11 minutes, she would describe later to 3 separate people in 3 separate settings. And each time, she would struggle to explain the order of events, because it happened in that way that emergencies sometimes do, where time stops organizing itself and everything arrives at once. Security came first, 2 officers from the main desk. The man by the elevator saw them and moved not toward the exit, but toward the hall, toward 3 and 14, with a directness that made her stomach drop. She hit the wall panel. The alarm was a single sustained tone, different from the code tones, and for a half-second the entire floor went still the way a room goes still right before something breaks. The door to 314 opened. Not Marsh. Cypher. She had not known that Cypher could open doors. Later, Calloway would tell her that Cypher had been trained for facility navigation, which was a phrase that apparently included lever-style handles, push bars, and whatever the Belgian Malinois equivalent of tactical patience was, because he had timed it with a precision she could not explain. The dog came through the door at a low, fast angle that she recognized instinctively as purposeful, and placed himself in the center of the hallway between the man and the room. The man stopped. Security caught him 14 seconds later. Calloway's people were there in 4 minutes. She stayed at the nursing station. Her hands were steady. She noticed this and thought it was strange. Marsh appeared in the doorway of 314 in a hospital gown, ivy line trailing, and looked down the hall to where the man was being restrained, and then looked at her. "Cypher," he said. The dog returned to him immediately, pressing against his left leg. "Yeah," Marsh said to the dog. "Good." He looked at Nadia again. "You called it," he said. She shrugged. "No," he said, "it isn't." He paused. Not usually. She didn't answer that. But she thought about it for the rest of the day. The investigation. She was told there was an investigation. She was not told the details. Moved around her for the next 2 days like a weather system. People came to the floor she didn't recognize. The nursing supervisor pulled her aside and told her that some personnel from a federal agency would be using the family consultation room and to please ensure her staff directed anyone to the secondary lounge. She said of course. She continued to do her job. On the 6th day, a man named Aldrich came to see her. He had the kind of face that had given up trying to look friendly and settled into neutral. He was with some kind of oversight office. He showed her a badge, but held it at an angle where she couldn't read the agency seal, which she thought was probably intentional. "You flagged the badge anomaly," he said. "I did, based on what exactly?" she explained. "The time log, the photo discrepancy, the behavioral observation." He wrote things down. "You were stationed at Portsmouth for 4 years, and before that Walter Reed. Before that, Camp Lejeune." He wrote something else. "You have a background in security protocol." "I have a background in paying attention," she said. "My mother was a 911 dispatcher for 22 years. I grew up knowing what a wrong detail looked like." Aldrich looked at her for a moment. Then he put the cap back on his pen. "Someone inside this facility facilitated access," he said. "The badge belonged to an employee on leave who had been contacted 3 weeks ago by a third party. He didn't report it. We're managing that situation." He paused. "You're not a target, Ms. Vance, but we'd like you to stay available." "I'm not going anywhere," she said. She saw Marsh every day. He was improving in the visible ways. Better color, less pain medication, sitting up, beginning the early mobility work with the physical therapy team. Cypher remained fixed to his side with the reliability of a compass finding north. She had stopped finding this remarkable and started finding it simply true, the way she found certain other things true. That Marsh had a low fever spike every afternoon around 4 that predictably broke by 6, that he slept on his right side when the medication allowed him to choose, that he read in the evenings, and the book was always turned face down when she came in, cover hidden, which meant it was probably something he thought looked soft and didn't want to explain. She didn't ask. She found his evasions reasonable. On the 8th day, he said, "You have a military tattoo." She looked at her forearm. The ink there was 12 years old, done in a parlor in Jacksonville when she was 19 and newly enlisted, a small insignia she had designed herself. A caduceus with one wing folded, which she had thought was meaningful at the time and still did, actually. Not for the reason she'd originally thought. The folded wing meant something different to her now, not incompleteness but restraint, the capacity to hold something back until the moment it mattered. "Navy," she said. "Nursing Corps. I thought so." He was quiet for a moment. Cypher noticed it the first day. She looked at the dog. "He's trained to identify certain insignia," Marsh said. "Core symbols, specific unit marks. It's part of his handler protocol. He can distinguish between military and civilian personnel in plain clothes." He paused. "It's why he let you in." She thought about that first moment in the trauma bay, her hand extended, the dog's evaluation, the half step back. "He was reading my tattoo," she said. "He was reading you," Marsh said. "The tattoo was just confirmation." She stood there for a moment with that. "That's not standard," she said. "No," Marsh agreed. "He's not a standard dog." The person who had facilitated the badge access was a facilities coordinator named Gwen, who had worked at the medical center for 9 years and had, somewhere in the middle of the previous one, made a decision under a kind of pressure that Nadia was told about only in outline. A family situation, a debt. The kind of vulnerability that people with specific interests knew how to find and apply. Gwen had not known what the man with the stolen badge had been intending to do. This did not make the situation less serious. It made it more complicated. Nadia thought about this for a long time. Not with judgment, exactly. With something more like recognition. She had been in positions where the pressure was real and the right path was clear and still nearly impossible. She had not always taken the clear path. She was aware of this. She thought it made her a more accurate observer of other people, though she held this belief carefully, because that kind of reasoning could also just be a way of excusing things. She did not say any of this to Aldrich. She said it briefly to Calloway, who looked at her in a way that suggested she had said something truer than expected. "You're hard to read," Calloway said. "People keep saying that," Nadia said. "Most people who are hard to read are trying to be. I know, you're not trying." "No," she agreed. "I just think before I talk. It takes longer than people expect." Calloway almost smiled. It was a small thing, quick, but it was there. Marsh was discharged on the 11th day. The process took the entire morning, as these things do: paperwork, pharmacy, follow-up scheduling, the PT team's final instructions. He was on crutches, moving carefully, Cypher matching his pace with an automatic adjustment that had the quality of years. She found him in the discharge area near the front entrance, waiting for transport. She had come to say goodbye. She had not thought past that. "You should have let security handle it," he said. "The man by the elevator." "You didn't have to call Calloway. Calloway's number was faster," she said. "That's not why." She considered not answering. "No," she said. "It's not." Marsh nodded. Not like she'd confirmed something new, like she'd confirmed something he'd already decided. "You made a judgment call," he said, "about who to trust and how fast to trust them, under pressure." He looked at her directly. "That's harder than it sounds." "I know," she said. "I've gotten it wrong before." He was quiet for a moment. "So have I." Outside the automatic doors, a black vehicle had pulled to the curb. Calloway was visible through the glass, standing by the passenger door. Marsh picked up the bag at his feet, looked at her once more. "The folded wing," he said, nodding at her forearm. I looked it up. The original symbol had both wings extended. "I know. Why'd you change it?" She thought about how to explain it. The Jacksonville parlor, 19 years old, the feeling of wanting to signify something she didn't have the words for yet. The years afterward, when she found the words. "I wanted it to mean something specific," she said. "Restraint. Knowing when to hold back and when not to. And now?" She looked at the tattoo. At Cypher, who was looking at her too. "Now I think it also means knowing the difference," she said, "between the two." Marsh held her gaze for a moment. Then he nodded once, short and precise, in the way she had come to understand was his version of a great deal. He walked through the doors. Cypher walked with him, steady at his left side, and did not look back, which she somehow knew was not indifference, but trust. The door closed between them. She stood there for a moment in the lobby, in the particular quiet that follows the exit of something you hadn't expected to matter. Then she went back upstairs. The floor was busy. It was always busy. She picked up the next chart, read the next set of vitals, walked into the next room where the next patient was waiting, and did what she had always done, which was the job, which was the thing she was good at, which was, she had long since decided, enough.